Please welcome to the podium, Jessica.
According to Shape magazine, breast cancer may be the disease most feared by women. It will strike 1 in 8 women at some point in their life, and more than 70% of these women don't even have any identifiable risk factors, such as family history or dense breast. Okay, how many of you have had like a mother or a grandmother or aunt go through breast cancer? Okay, what about like a dad or a grandfather or uncle? It can happen in men too. Okay, today I'm going to talk about breast cancer, how to reduce your chances of getting it, whether or not it's hereditary, and some options for treating it. My first point will be on how to reduce your chances of getting breast cancer. According to Prevention magazine, mammograms, which are the staple of breast cancer surveillance, is ironically a risk factor for the disease because ionizing radiation can cause DNA mutation in the cells. And this doesn't go to say that you shouldn't have a mammogram at all, that you should just like minimize your exposure to radiation therapy if possible. Like if you don't need to have one, if you're say like under 30, then you probably should be getting screened for breast cancer. And also, the Women's Health Initiative found that a long-term use of combined estrogen plus progesterone therapy, and these are both hormones, increase a woman's risk of breast cancer by 24%. Limiting hormone therapy to as little as possible can help a great deal with prevention of this disease. And research continues to produce promising evidence that what you eat can affect your risk also. For example, Harvard researchers recently found that women who had the highest carotenoid levels, carotenoid is found in fruits and vegetables, in their blood had 19% lower risk of cancer than those who had lower levels of carotenoid. And basically, if you eat like more fruits and vegetables, you'll less likely have breast cancer than a woman who eats less fruits and vegetables. So that's why I have the picture of fruits and vegetables on my slide. And finally, it's best to limit your alcohol consumption to at least 1 drink a day because any person who drinks more than this can increase your risk by more than 1.5 times than someone who doesn't drink at all. And I've told you about how to reduce your chances of getting breast cancer. Now I will tell you whether or not it's hereditary. According to Red Book, a woman with a mom or sister who had breast cancer has double the average risk of getting it herself. Having male relatives with it, which is rare but possible, also raises the risk. About 5 to 10% of breast cancer cases can be attributed to inherited gene mutations, also according to Red Book. Women with a strong family history may want to talk to a genetic counselor. I've told you about whether or not breast cancer is hereditary. Now I will give you some treatment options. Chemotherapy or hormone therapy is best for the smaller tumors. And chemotherapy, some side effects are like hair loss. You can lose your fingernails or your toenails. I know this because this has happened to my mom. And also, I've got to tell you my credibility. My mom and my grandmothers on both sides of my family have had this disease and they survived. So that's good. And FDA consumers state that drug therapy can also help, but cancer drugs can have serious side effects such as infection, sap energy. It can cause bruising or bleeding, nausea, vomiting, mouth sores, loss of appetite, and hair loss. Treatment may also include surgery or radiation therapy or both to control the breast tumor, and that's usually if the tumors are bigger. As you can see, there are several options for treatment. A woman's best bet, though, is to get more than one medical opinion and decide from the feedback that you get. I've just covered 3 important things about breast cancer: how to reduce your chances of getting it, whether or not it's hereditary, and some options for treatment. Really, it is best for every woman and man to know about this disease. If you have any questions, you should definitely research for yourself. And I've always heard you should know more about breast cancer than any medical professional. And definitely you should know about your own body more than anybody else, and also your own breast.